Leta, and I'm from Eugene. My mom apparently overdosed on aspirin, and my dad had the ambulance take her to Sacred Heart in Eugene, and in addition to overdosing, they said she had pneumonia and a bladder infection. And when she was 3 weeks later, after she was released from the nursing home, actually 4 weeks later because she was in the hospital for a week, turned out she didn't have pneumonia and she didn't have a bladder infection. All of the symptoms were from her overdose.
Wow.
So they treated her for something that she didn't have. And then she went to a nursing home after being in the hospital for a week. And they didn't have any information from the hospital, or they didn't have updated records. And I mentioned to the speech therapist that she had pneumonia and they were working with her on her swallowing. And she had no idea, but it doesn't matter because she didn't have it anyway. But they didn't have current records when she got there, so they couldn't set up her program. And the first day she was there, my dad met with a case manager who was supposed to oversee all of her care and make sure that it was all coordinated. And the woman quit that day or the next day, and they never replaced her, so they didn't have anybody to coordinate her care. When she was in the hospital, they put her on the patch so that she wouldn't have nicotine withdrawal because she smoked.
And is she on Medicare?
Mm-hmm.
Okay, so
yeah, and she has. My dad bought her insurance, additional insurance. So she had a speech therapist, an occupational therapist, and a physical therapist. And the speech therapist was supposed to help her with her swallowing because she had trouble. She would choke. And they wanted her to, when she was admitted to the hospital, she was delirious, so she didn't really know what was going on. So they wanted to make sure that she was aware and able to function on her own. So she worked with an occupational therapist, and they had her boil water and do stuff like that. And her physical therapist just had her walk around the grounds. They wanted to make sure she could get around on her own when she was released. And then, so she was in there 3 weeks, and she had gotten as good as we thought she would get. So my dad wanted to get her out because he didn't know if it was going to cost him. He figured out when she was like about 3 days into when she was in the hospital that supposedly he wouldn't have to pay anything. And then he just recently got a bill for $300. So, and of course that's huge when his income is $900 a month.
Yeah.
So I don't know if he's resolved it yet or not. So she was supposed to be, he wanted her discharged, and this was 3 weeks after she had been in the hospital, because he thought she was doing as well as she could, that they could help her with. And so he talked the nurse practitioner into releasing her on, I guess it was a Monday. And so he showed up, and the therapists and the nurse practitioner all agreed that she could go home. So then a social worker shows up that nobody has ever met. My dad has never seen her before, and I never met her. And she was furious because my dad was taking my mom out of there and didn't give him 24-hour notice. And she had no idea that he was taking her out. And my dad's like, "Who are you?" He was just appalled because he had never seen her before. And she said, "Well, I came down a couple times to meet with you, and you guys were out walking around or something." So she didn't make a very concerted effort to meet with my father.
Wow.
So that was ridiculous. And then when they got home, they sent her home with a walker that was not adequate for her to use. So I think they tried to go through Medicare to get her one that needed to have big wheels and have it where she could sit if she got tired. And the one they sent her home with, we had little tiny wheels, and if she went outside the house, she would have fallen down. So they waited and waited and waited, and it never came. So my dad finally just went out and found a used one and never tried to get back to them to get them to do it. So he felt like they weren't going to help him out at all. See, I think that's all. Oh, so she was admitted to the hospital with an overdose. And this whole time, nobody addressed her
I
mental
was gonna ask.
issues at all. Nobody. And I mentioned to the nurse that she had the same nurse for like 4 days, and I mentioned to her that she might have depression. They didn't. They treated her for the pneumonia and the bladder infection, and to get the toxins out from the overdose. Then they sent her to the nursing home, and they worked on all the physical stuff, and she didn't meet with a counselor or anything for her mental state. And she was still in a confused state when she entered the nursing home. Sometimes she couldn't remember who I was.
Oh, wow.
And she didn't know.
Did they do any kind of workup on her memory then?
They actually, toward the end, they started trying to work with her on her memory. They would do like card games where they would show her the card and they'd turn it over and she'd have to tell them what it was. And they did do a CAT scan and they didn't find anything abnormal. But my dad had to really, really push for that. I mean, it was the 3rd week that she was in the hospital, or in the nursing home, that they finally got to that. So, I mean, it didn't show anything, so we still, I guess maybe her memory problems are from the overdose, but we don't know. My dad took her to a follow-up appointment with her doctor. When they went to see him, he said that all the tests came back from being in the hospital and she didn't have pneumonia and she didn't have a bladder infection, and that she's fine. And they didn't question why she overdosed on aspirin. And so she's obviously having pain. She's taking so much aspirin. We kept asking them, to look at her back, because she had been in a car accident several years earlier and was just in the hospital overnight. So when they started giving her Tylenol for her back pain in the hospital, and they kept giving it to her when she went into the nursing home. And my dad has made sure that she takes it daily. When she went to her follow-up appointment with the doctor after leaving the nursing home, they found finally that she had shattered a disc in her back during that accident all those years ago, and that's what's causing her pain. It had healed improperly. And so, but they're not doing anything to make it better. They're just telling her, oh, this is what it is.
And what's her primary medical condition?
Oh, she has emphysema. Let's see, they prescribed her the patch to help her stop smoking, and she has stopped. He has to go to the Veterans Hospital in Roseburg.
And how far is that from where he is?
That is an hour drive. So he had prostate cancer and was treated for like 3 months. And he had to drive every day, 5 days a week, for his treatment, back and forth. And his last treatment, I think, was on the Thursday that she was in the hospital. And then he was done, but then he was still recovering. So I don't think he missed a day coming back, though. I think he was there he was there every day that she was in the hospital in Eugene, after having driven to Roseburg for his treatment.
That's pretty.
He worked for the government in California under the employment division, and he just is, so he has a pretty good understanding of what goes on in policy making. I was talking to him when my mom was in the hospital, and it has nothing to do with providing care or what's best for the people. I mean, that's not even on the list at all. So it has to be, they need to take the money part out of it and make it about the care and not the profit. So it would be helpful to have health care for everybody.